Hi, my name is Dr. Sarah Bjorkman, and I am a board-certified OBGYN and also a reproductive endocrinology and infertility specialist. You may have followed us through our last pregnancy and postpartum and all of the things. And now, as we are trying for baby number 2, found ourselves unable to get pregnant and are now doing IVF. So the IVF doctor has now become the patient, and I thought it would be helpful to go through IVF medications, how to give them, how to draw them up, and so come along with me as I give myself my meds tonight. So the first medication we're going to talk about is Follistim. So Follistim, or Follitropin beta, is the medication name, is given with a pen and needle. It's kind of their proprietary administration method. The pen looks like this, and the medication comes in this little tiny cartridge, usually 600, 900, 300 IUs are in the varying sizes of cartridges. The Follistim cartridges should stay in the fridge until their first use. After the cartridge has been in the pen, so the first puncture, it is stable at room temperature for 28 days. If you happen to leave that cartridge out, but don't puncture it, it's stable at room temp for 90 days. So Follistim is kind of a synthetic FSH, or follicle stimulating hormone. And what that does is it does just what it said, stimulates those follicles. So it is telling your ovary to grow all those follicles. Because with IVF, the goal is kind of to get as many eggs as we safely can. And so we often start that with Follistim, FSH. There's another brand called Gonal F. It's the same medication, but we're talking the differences like Pepsi and Coke, okay? And so tonight I'm gonna show you Follistim. So the Follistim pen comes in a box like this, and looks just like a pen. So to do it, you will take your Follistim out of the fridge, get your cartridge that looks like this. You see, we are gonna put this cartridge here on the pen and put this pen together. It screws on, you line up the little arrow with this little yellow marker, and we are ready to go. The first thing you wanna do, once you get this screwed together, is dial the dose on your pen, okay? So there's a little IU marker here, and you're gonna dial your dose up to the numbered markers, 150, 175, 200, 225, whatever your dose is. Now, the thing with the Follistim pen is you cannot, if you go past the amount you need, it won't let you dial back. And so you dial all the way up to 450, and then it allows you to reset and go back to 0 and start over, okay? Another important caveat is do not put the needle on your Follistim pen until you get your dose appropriately dialed to the right spot and are ready to go. Because while I said if you get it to your dose and it won't spin back, if you have the pen on and you try to dial it back, it will go back because it is spitting out medication out that needle. So always make sure you have your dose ready to go in the right spot before you put that needle on, okay? So I'm gonna dial my dose up here. Perfect. Another little pointer about this medication, usually the cartridges are 300, 600, or 900. There is always some extra medication in those cartridges, maybe even 100 IUs more than what it says. So don't necessarily be keeping track of how much you've given yourself. It's okay to have like a general idea, but you know, if you had a 300 IU cartridge and you gave yourself 150 one night and 150 the next night, there still might be some medication, 50 to 100 IUs in that cartridge that you're gonna wanna use. And I'll tell you more about that in a second. But I need to give myself my medication now. You wanna give your meds at the same time every day, as close to the same time as possible, kind of plus minus 30 minutes every day is the window that you're trying to stay in. So with the Follistim, you're going to get your alcohol swab. Since this has been used before, I'm going to wipe here the little puncture site. Follistim pens come with their own special needle, okay? And so you take the top off the needle. You then take the pen, push it on, screw till that needle is screwed on, like that, and then you pull it out. And there is still a plastic tip on the needle itself, but dose is dialed, needle is on, I'm ready to go. As I said, subcutaneous injections. You want to belly button to the nose. We are injecting in the smile, or if you can see from here, the places where I have bruises under the belly button. So you're gonna pick your spot, and with all your shots, you're gonna, if you have to give yourself multiple shots, you want your injections to be at least an inch apart from each other when you're giving them at the same time. So we're gonna pick right here. I'm going to clean it with my alcohol swab. I'm going to take the cap off, needle, so you can do straight 90 degrees or 45, doesn't matter, but your needle has to go all the way in. So you are going to inject or poke your needle in. And really the first night, the scariest part was actually poking the needle in, but it does not really hurt once you do it. The pharmacist was like, it's like poking a needle in a hot dog. I said, that's not very polite. But anyway, needle's in. You're going to inject your medication. You'll hear it click. Click, 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 till it goes down to 0. Then count to 3. 1, 2, 3. Pull the needle out. Voila. You're then gonna put this needle back in, kind of unscrew, and take it off. The other thing you want to have with you whenever you're doing your shots is your handy dandy sharps container. Put that sharp back in your sharps container. Okay. So that was Follistim. The one other thing to say about Follistim is, if the cartridge doesn't have enough medication in it, so let's say you had to give yourself 150 IUs tonight, and you inject, and then it stops at 25. That means you gave yourself 125 units and you need 25 more. But when you inject, it will stop at 25. So what you do is you just unscrew it, you put a new cartridge in and put a new needle on and inject that last 25. The Follistim just remembers. It's pretty cool. So if your cartridge ever runs out mid-injection, do not worry. You just are gonna put a brand new cartridge on. It will be spun to where you need, put a new needle on, and inject. It totally sucks because you have to poke yourself again, but the cartridge is ready to go. All right, the next medication we're gonna talk about is called Menopur. So it comes in a box that looks something like this, and Menopur is a combination of FSH, so like what's in the Follistim, follicle stimulating hormone, and LH, or luteinizing hormone. And so again, what this medication is for, is to stimulate those follicles to grow, as well as to help them get mature and be ready to ovulate. So this is Menopur. Menopur is a little bit different in terms of mixing and storing. So Menopur can be stored at room temperature or in the refrigerator with the same stability. And so you can just store it on your counter or kitchen table or whatever you're keeping your meds, and you don't have to worry about it. It is good until the expiration date on the box. And they say store from 3 to 25 degrees Celsius or 37 to 77 degrees Fahrenheit, okay? So your pharmacist with most of these meds will usually give you some kind of handout with pictures of how to inject medication. I know that this can be a lot, and so it's really nice to have that to go through that first couple nights you're giving yourself your injection and figuring out how to do it. Do not be ashamed if you need help. YouTube, The medication pictures they give you, use them to make sure you're doing it right. These meds are so expensive. You want to make sure you're doing it right. So you're going to want to gather all of your supplies. So you're going to want your Menopur powder and your saline. So Menopur, in that box, there are 5 Menopurs, and you may take anywhere from 1 to 3 vials of Menopur a night. So the medication is this powder. It's in one of the vials that says Menopur, and you'll see this white powder at the bottom, and it comes with a matching saline to go with it. And then again, there is another. I have to take 2 Menopur tonight, and so I will take the Menopur out, and there is a matching saline, but if you need to take more than 1 vial of powder, you only ever need 1 vial of saline, okay? We're just gonna concentrate the Menopur a little bit more. So Menopur also comes with something called a Q-cap. It is their proprietary way to mix these medications, and it's actually pretty sweet. The other things you're gonna want to gather are your syringes. You're gonna want about a 3 ml syringe that your clinic should order for you, and then you will want a very fine needle. So I have a 27 gauge 1/2 inch needle. Sometimes it's a 25 or 26 gauge, but very small needle, okay? So these are all the things you want to gather. You also want to gather your alcohol swab. So the rundown for all the things you need for Menopur are your Menopur vials, a vial of saline, a syringe, usually a 3 ml Luer lock syringe. That means it has a screw on top, as well as a needle for injecting, usually a 1/2 inch 27 gauge needle, as well as an alcohol swab, okay? And that's gonna be for swabbing your abdomen. So let us begin. First thing I'm gonna do is open this needle syringe. Mine happens to have a needle on it, which I will not need, so I'm going to drop that in the sharps container, which you also have nearby. Next thing I'm going to do is open this Q-cap. It is a plastic cap that you are able to connect to these little vials. So I'm just gonna start with the sodium chloride. This is your saline to mix with the Menopur. Saline vial, Q-cap. Just there's a kind of a sharp thing on the inside of this plastic Q-cap. You don't want to touch this Q-cap to anything else. This is all sterile. You puncture the plastic on the saline, and then our Q-cap is now on this saline, and it allows you to draw out of these tiny little containers easily and safely. So I don't know how well this is translating, but the Q-cap is here. I am now going to screw on my syringe here, and then I'm going to tip this upside down. Actually, pro tip, what I would recommend is you fill your syringe with about a 1 ml of air, fill it up to the 1 ml line, then screw it on to the Q-cap, and then inject that air into the bottle, and it will help your saline come out. So now we are going to draw back and get 1 ml of saline. I'm gonna flick any little bubbles out. There we go, there's still an air bubble there, so I'm gonna draw it back one more time. Perfect, got rid of the air bubbles. Okay, 1 ml of saline. Now what I'm gonna do is I'm going to just kind of bend off this saline, because I don't need it all. There's 2 mLs of saline in here. I only need 1. And I'm going to do the same kind of thing. I'm gonna flick open the Menopur. I'm going to take the Q-cap with my 1 ml of saline in it, and I'm going to puncture this Q-cap into the vial, and then I am going to inject that 1 ml of saline. And you'll see that powder just instantly dissolves, and you're gonna wanna gently, gently swirl this to make sure it's all dissolved. Don't shake, don't spit in your hand, just kind of gently swirl it, and you'll see that it's all dissolved. Now, so that's 1. If you only need 1 Menopur, you are good to go here. And so we're going to tip it upside down again. We're going to withdraw that 1 ml out. I have a huge air bubble here, so I'm gonna flick it. And I'm going to go back to that 1 ml line. Now, air bubbles, you're injecting sub-Q, they are not a big deal. If you have a small air bubble, it's okay if you have a tiny air bubble. Again, I need a second Menopur tonight. So break this, kind of bend it. Q cap is still attached. I get my next vial of powder, my next Menopur vial. You just flick off this cap that's on it, Q cap, puncture this little plastic on the top, just like that. And now we are going to inject this liquid, which is 1 vial of Menopur and 1 ml of saline. We're going to inject it in. That white powder, again, dissolved really quickly. I'm still going to stir it around here, gently, gently swirling. That's all perfectly dissolved. And now I'm going to put it back in my syringe. All right, there's a little air bubble there. And we are good to go. Now I'm going to unscrew the Q cap because now it's time to put on my skinny, skinny little needle. I'm gonna open that small needle. I'm going to attach it to my syringe that has the Menopur in it, and now it is time to inject. So, alcohol swab. As we talked about before, we are injecting around the belly button in the subcutaneous tissue, belly button, kind of the smile under it, okay? I just did an injection over here of the Follistim. I want to be at least 1 inch away from that. And so I am going to go right here. I'm going to clean this off. Voila, I'm going to pinch. I'm going to take my needle off here. It is pinched, and I'm going to, you can either do it 45 degrees, 90 degrees, doesn't matter. I have an air bubble, it's okay, it's a very small air bubble. I'm going to push in here, and I'm going to inject the medication. Now, Menopur tends to burn with injection. Yep, burning, feels so good. Things you can do beforehand, you can ice ahead of time for 10 minutes. Just hold ice here on your abdomen. All right, push the syringe, all the medications in, hold for 3, 1, 2, 3, needle out. Carefully recap, and then dump that right in your sharp container. So Menopur tends to burn when you inject it, as I mentioned, as I felt. You can use an ice pack. A lot of fertility clinics will have kind of special little ice balls that you can put in the freezer. You can hold that on your abdomen for 10 minutes beforehand. Can really, really help with the burning. The next medication we're going to talk about is called Ganirelix. Comes in a box like this, and very nicely, Ganirelix comes in a pre-filled syringe. You do not have to draw it up. You don't have to do anything special. The medication is in it. There's a needle on it, and it is ready to go. So Ganirelix is stored at room temperature, and it is good until the expiration date on the syringe. So again, it recommends you store between 15 and 30 degrees Celsius or 59 and 86 degrees Fahrenheit. Ganirelix or Cetrotide is kind of the other sister medication, same medication, different brand, is a GnRH antagonist, or often this is just called the antagonist. And these work to keep you from ovulating early. So that Follistim and that Menopur are working, telling your ovaries to make as many eggs and grow as many follicles as they can. And your brain then knows those follicles are starting to get bigger and starts to think, hey, I should ovulate. And the antagonist is taken to stop the brain from telling your body to ovulate. Because when you're doing IVF, we want to go and retrieve those eggs. We do not want your body to ovulate. And so we are stopping ovulation with the Ganirelix or the antagonist. So again, this one's very important. You take it at the same time every day. Usually your clinic will recommend you take it between 6 and 9 a.m. in the morning. Whatever time works for you in your day, take it at the same time every day. Again, plus minus 30 minutes is that window you're shooting for. So again, Ganirelix is easy. It's another subcutaneous injection, and I'm not taking this right now, but I'm going to show you just for fun. You, again, take this pre-filled syringe out of the box. There is a cap. You remove the cap. It is just ready to go. Pre-filled syringe, sometimes there's a little air bubble in it. Don't worry about it. Just give yourself this injection because you don't want to lose any medication worrying about it. So again, you're going to do what we have for all the other ones. You are going to get your alcohol swab. You're going to find that smile under the belly button, clean yourself a spot, pinch, and then you are going to inject, okay? Inject all the medication, hold 1, 2, 3, take the needle out, put the cap back on, and again, drop it in your handy dandy sharp spin. Now, things with Ganirelix. Again, as I said, the bubble is fine. You don't want to lose any medication, and so you don't have to worry about the air bubble. This is a subcutaneous injection. Don't worry. That air is going to come out of your subcutaneous tissue molecule by molecule. Don't worry. The other important thing to know about Ganirelix is that 80% of patients are going to have redness at the injection site about 2 to 3 minutes after. It goes away in a few hours. It doesn't hurt, but most patients have that. So just keep that in mind. Don't be alarmed. You may notice that. Just a little word about side effects. 1 in 4 patients experience some side effects similar to PMS symptoms. So headaches, mood swings, insomnia, hot or cold sweats, breast tenderness, and bloating. These are short term. They're only happening while they're taking the medications. And so just things to be aware of. You are giving yourself hormones every day. Some of these side effects may happen. Reasons to call your doctor, because something that can happen when you are undergoing IVF is something called Ovarian Hyperstimulation syndrome, and it is a dangerous thing where your ovaries are so hyperstimulated. It's kind of a state of distributive shock, and your ovaries simply kind of start to pull fluid from your circulation, and your blood gets thicker and you get really, really bloated, and it can make you very, very sick. You have electrolyte imbalances, you can get fluid around your lungs, and very uncomfortable, very sick. And so reasons to call your doctor are you have terrible, terrible bloating. Your belly hurts. You aren't eating like normal because you don't feel well. Your urine output is decreasing, so you aren't going to the bathroom. You aren't urinating as much as normal. Again, you're really bloated. You gain 4 pounds in one day. These are reasons to call and let your doctor know that you just aren't feeling well. Women that we worry about OHSS the most with are women that have a really high ovarian reserve. So you had a lot of resting follicles, or your AMH is really high. Those are the patients at the highest risk for it. And often we have those patients on the safest protocols that we can do, which is an antagonist protocol. But those are just things to be thinking about when you are taking these medications. If you have any questions, always call your doctor. Your clinic will give you usually a kind of a list of numbers to call. And so you can absolutely call them. Again, these are expensive medications, and so a mistake can be very expensive. So if you have questions, make sure you are asking the nurses you're working with or the pharmacist what to do, and make sure you understand giving yourself those medications because they're tricky. I am an IVF doctor, and I sat down with our pharmacist to go over how to take these medications because it's always good to review and make sure you understand everything that's going on. So don't be afraid to ask questions. I asked lots of questions, and I mean, these are my notes. Like I took front and back pages of notes on administering these IVF meds, and I'm an IVF doc. So don't be embarrassed. Take all the notes you want. Have your partner come with you if you can. It's a tricky process and a little scary, and you never thought that you were going to become a pro at giving yourself injections. And probably your partner or someone's going to have to help for some of the later ones. So you can do it. I'm right here with you. See you soon. So those are all the medications for the moment. Other medications that we're going to go over are trigger medications. There's different trigger medications that need to be taken at a very specific time, as well as progesterone and oil. And so we are going to cover those next.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.